So, we are demonstrating today the instruments of the Zimmer Biomed Comprehensive Reverse Shoulder Systems. So, typically we start with the deltopectoral approach. Some surgeons prefer to use the deltoid splitting lateral approach, but most commonly the deltopectoral approach is used. Usually the subscap peel off is done to expose the humeral head, and the humeral head is dislocated, right. So, once you have dislocated the humeral head preparation starts. So, this is an humeral head introducer perforator. You typically take entry just posterior and medial to the bicipital tuberosity over here, somewhere here. So, this is the perforator. You just take an entry with it, don't push it hard because this is having a sharp tip. You may perforate the cortex in the shaft in elderly patients due to osteoporosis. So, then you do the sequential rimming using different size of rimmer. So, most commonly used stem is mini stem in normal conditions. You can use the larger stems in revision cases, or in trauma cases you can use trauma stems. So, most commonly used stem is mini. So, once you have decided the reamer size, particularly it will range between 9 to 12 size. So, you need to put the reamer till there is a mark. So, there is a mark over here. So, it is written 1, 2, 3, 4 like here. So, you need to sit it till the mark between 3 and 4. So, this is between 3 and 4. So, it will typically lies like this. Okay, and this is the version. So, usually I keep 20-degree version on the humeral side. So, 20-degree retroversion. This version rod should be aligned to the forearm, which is bent at 90 degree at the elbow. So, that decides your version. So, it will be around like this. Okay. Then this is the 45-degree neck cut. So, it has marking the right and the left. So, this is the left shoulder. So, left should be facing anteriorly like this. So, it will be the top screw will be tightened. This should be aligned with the forearm, and this should touch the humeral part around the head and neck junction, right. You can adjust the length with this if there is a severe distorted humeral head in advanced arthritis. So, if your humeral head is flattened in this area, you may need to put it less in, or sometimes due to osteopathy you may need to put it more in, but you can even adjust the humeral head cut afterwards. So, it is ideally it should cut 1 mm proximal to the insertion of the rotator cuff. So, 1 mm proximal to the tip of the greater tuberosity. So, this will put like this, and you will put 2 pins through this jig. Then, so there are different options over here. So, there are convergent pins, horizontal pins. If you want to put plus mm, so you first initially put these 2 pins, and then you can remove this and you can have the plus 2 mm. So, you can adjust from these holes also. So, you just fix it with the neck, then you need to remove this the central reamer, because that will come in the way while putting pins through and through. So, it will be like this. So, now you take a saw and cut this humeral head. So, once your humeral head is cut, then you need to prepare it. So, usually I prepare the humeral head after the glenoid, the humeral shaft with broaching after the glenoid preparation is over, but for the sake of the preparation we will finish it right here. So, once you have cut the articular part of humeral head, this is the rasp or broach, you can say. Again, it is having version rods. You can check whether it is on the left or right. So, it is marked with the L and R over here. So, L and R over here. So, this will go towards the calcar, the neck of humeral head. So, this will go like this. So, you need to broach it till this sits well on the calcar, right. So, you need to do sequential broaching till it matches the size. So, usually you should not go beyond the size which is being decided by rimming previously. So, you should not, so if it is an 11 size rimmer, you should not go beyond the 11, because there are chances that this might stuck in the shaft and there are chances of fracture over there, right. So, once the humeral preparation is done, you can keep the broach inside the humeral shaft and metaphysis. Then you need to retract the cut humeral head back posteriorly like this, and you need to do 360-degree capsular release to have the proper exposure of glenoid, right. So, typically two retractors are being used, the glenoid neck retractor, which one goes anteriorly, and one like the just like acetabulum, which goes, so this will goes like this, right, and you can use this retractor also over here, or you can use two prong retractor over here, which will push your humeral head and shaft back, right. So, once your glenoid is exposed properly, you need, so this is the most important step, you need to expose glenoid throughout the 360-degree, you need a proper view of glenoid, then you can mark the glenoid in 4 quadrants. So, this is from the supraglenoid tubercle in the center of glenoid to the lower part, and one is horizontal in the mid part of glenoid. Then this is the jig or the guide for putting the central pin inside the glenoid. So, central pin is the most important and critical step in reverse shoulder replacement, because of deformed glenoid like in B2 glenoid or C type of glenoid. You need to decide preoperatively using CT scan the optimal position of the central pin. So, central pin ideally should engage the medial most part of the glenoid. So, it should be in line with the scapular spine. Typically, it is drilled in the lower half and slightly posteriorly somewhere here. So, what we do in this system, there is an inbuilt 10-degree tilt. So, that is superior tilt which is available. So, this jig is kept in the lower quadrant of the glenoid like this, hold it, okay, and then this is the central pin. So, this is 3.4 mm central pin with the threads. So, it will go like this. So, once it is in, you need to remove this will be removed like this. So, this is like horizontal, and this is the 10-degree superior tilt. So, the superior tilt will minimize the scapular notching, and it will provide more room in the subaqueous region also. So, once you drill and cap the central pin, then there is a central reamer. So, this is the reamer. So, this is the typically Indian patients are having small glenoids. So, we most commonly use the mini base plate, that is 25 millimeter, and the reamer is typically for the same. So, you need to ream the glenoid with over this central pin. So, this will create a larger hole for central peg part of the base plate, and then there is a peripheral rimming over here. So, typically you will have more rimming in the lower part of glenoid. So, that will create a kind of smiley face in the lower part with exposed soft bone or subchondral bone over here. So, once you have done the reaming, your central pin will be still there, right? So, then you need to implant on the same pin the base plate you have decided. So, usually it is mini base plate which is implanted in the center. So, suppose it is the base plate like this, okay. So, and then your base plate is, once it is press fit, then you need to drill the central hole first. So, central hole will be drilled with 3.4 mm drill bit, and then you need to decide the depth. Typically it is between 30 and 35 millimeter. Then you put the central screw, that is 6.5 millimeter central screw. So, once you put central screw, so typically you need to align the base plate like this. There are 4 holes in base plate. So, there are markings on the handles. So, this base plates typically the upper screw and lower screws. The upper screw should be aligning with the base of the coracoid and lower screw with the neck of the scapula. So, that will give the maximum purchase and the longer trajectory of the screws. So, superior and inferior screw. So, first you put central screw, that is 6.5 mm, then you have options whether the locking screw or non-locking screw. So, locking screws has inbuilt 5-degree divergent in this system. So, you can use locking screws, superior and inferior. I do not tight both simultaneously. I first put inferior screws, keep it a little bit loose, then put a superior screw and keep it a little bit loose, and then I tighten both. And then if the size and the space permits, I put anterior screw and posterior screw. So, more often I put central screw in superior and inferior screw, and sometimes anterior and posterior screw. So, at least 3 screws are mandatory for this any reverse shoulder systems. So, once you fix the glenoid base plate, then there is a glenosphere. Now, the glenospheres have different options. So, usually 36 millimeter standard glenosphere is being used because of smaller size of patients. There are other options like 41 mm and even 44 mm, but it is rarely used. And again in glenosphere you have the options of +3 and +6. So, you can even lateralize the glenosphere, right. So, the other modularity in this system, you can have an inferior offset in the glenosphere. So, glenospheres are having markings of A, B, C, D. So, A is in the center, B is in 1.5 millimeter, C is 2.5 millimeter, D is 3.5 and E is 4.5. So, depending upon the position of the base plate, you can do distalization or inferior offset of the glenosphere. So, once if you put glenosphere slightly inferior, it will have less chances of scapular notches and more subacromial space. So, at this point you have decided the size of glenosphere and offset. You fix the glenosphere first, that is over. So, the glenoid part is over. So, glenosphere is particularly a tapered fit. There is no central screw in this system, right. Then again we come towards the humeral side. So, you have done the broaching, the size has been decided, then you take the final step and then you take the trial. So, these are the humeral bearings and these are the humeral trays. So, humeral trays are having 3 options. So, this is the standard, this is +3 and +6. So, these are the offsets which marked with the different colors. So, this is standard +3 and this one is +6. So, that will ensure the coverage. So, standard will be in the center like this. So, +3 will cover more superiorly and +6 will even cover more superiorly, right. And there are different options in the bearing also. So, this is standard bearing. So, that will go fit in this. So, this is marked with superior. So, the broader one and narrow one. So, there is a marking on this base plate humeral tray. So, it will fit like this. Okay, like this. Okay. So, so this narrower one will go superiorly, this broader one will go inferiorly, right. So, you should keep in mind which goes up, which goes down. So, if you feel your reduction is little bit loose, you can increase the size of the insert. Even there are retentive poly which is more deep and like deep dish that can be used in shoulder instability or dislocation of shoulder. So, this is for trial. Then you take a call after reduction whether it is tight fitting. You check with the telescoping, check with the tightness of conjoint tendon, and then you remove this trial and take a final implant, and then you just reduce it and you check the final movement, right. So, this is the instrumentation system which is available with the Zimmer Biomet reverse shoulder comprehensive system. Thank you.